Hello, welcome to our webinar series from the Washington County Chamber of Commerce. This is Wendy Ragonis, and we also have Shay Janner on the line, working the technical logistics in the background. And today we are very excited to bring to you Esteban Pedraza. He is a project manager and has quite a lengthy bio and expertise. Has a Master of Science degree in Engineering Management from the University of Texas at Arlington and a Bachelor of Science degree in Biology from the University of Texas at San Antonio. And he has his Lean Six Sigma Master Black Belt credentials from the University of Texas at Arlington. So I don't want to take up too much of his time, but we were having some great conversations before our webinar began, and I'm very excited about his presentation today. And so I want to say thank you for joining us. And Esteban, I'm going to actually just turn it over to you to get started. I know we've got about 30 minutes, and we'll take question and answers as a question and answer period as they come up. And we'll also have some time at the end as well. And Shay, you want to review with everyone how they can ask a question?
Yes. You'll be able to type in your question. They are monitored, so I will have to view it first and then I'll share it with Esteban during the presentation. There is a little bit of a delay on our viewers' end, so some of the questions might come in that are referencing something that he just talked about, but they're seeing it about 20 seconds later. So just bear with us with that, and you should be able to type in the question, I think, on the right-hand side of your screen. That's all.
Okay, thank you for that. And so we're going to get started with Esteban. Thank you so much for your time, and I look forward to you telling us how to manage business and keep our workforce safe during the coronavirus pandemic that we're going to be living with for the next period of time. So Esteban, I'll turn it over to you.
Thank you, Wendy. Shay, thank you very much. Let me go ahead and share my screen here. All right. Now, can you all see that?
Yes, we can see your screen.
Okay, great. Thank you. Well, thank you again, and thank you all for joining us today. Once again, my name is Esteban Pedraza, and I am with Texas A&M Engineering. Now, today's topic is managing business during COVID-19. One of the things that part of my background, besides working with Texas A&M, in the past, I actually was a health inspector as well with Dallas County Health Department. And during my time with the Dallas County Health Department, it was during Katrina. During Katrina, we had several issues with evacuation shelters in Dallas. And I was part of the team with CDC that developed the recommendations to make sure that that the individuals within the shelters were taken care of. In fact, I'm a co-author of the public health guidance document for evacuation shelters with the CDC. So a lot of the information that is on this presentation come from a lot of the lessons learned, besides the knowledge that comes from CDC and OSHA. So let's go ahead and get started. All right, so the objectives here are to try to understand the role of employers and employees during COVID-19. What are your responsibilities and what are the employees' responsibilities? You know, identify the appropriate safe work practices that should be used during this time, during the pandemic. And we'll talk a little bit about recognizing the key components of our continuity of operations plan, or our COOP plan, and what a COOP plan is and how organizations should use a COOP plan, and why it's so important to actually have a plan. All right, so roles of businesses during COVID-19. So the responsibility is to serve the community by doing the best to decrease the spread of the virus, right? So we want to provide a healthy and safe work environment to protect employees, provide a healthy and safe environment to protect customers as well. And since we are businesses, we want to make the adjustments that are necessary so we can make a profit. can maximize our business operation. And during the pandemic, it's been really hard to make those adjustments and to be able to keep up with the margins that are required in order to stay open. So we want to talk a little bit about that. All right, so as an employer, what are the responsibilities, what are the roles of the employer during COVID-19? First is you want to stay informed. You want to stay informed about internal information and external information. So let me explain. When we talk about external information, we're talking about any restrictions or guidelines put in place by your local and state authority. What are the guidelines? What should we be doing as an employer, as an organization? And also, what's the level of disease transmission in the community? Okay, is our organization within a hotspot? Are we on the other side of the curve? Where exactly are we as a community where our organization is located or a facility is located? That's the external part. Now, the internal part that we want to be informed about are the best practices that are being used within our industry. What are the best practices? What should we be following? What are some of the things that we should be doing? And also, since something that's important and that we don't always think about is the mental and physical health status of their employees and their capacity. What are they able to do? Okay. Now, during the pandemic, it's important that employers not overlook the mental health of their employees. These extreme changes in our lives can have a great impact on our mental health. These are things that we don't always think about. But with everything that's occurred, all the issues that we may have with work, at home, just the fear of what could happen to not just us but our families, that's something that does have an impact on our mental health, which in turn has an impact on productivity at work. So those are things that we want to be thinking about as an employer. Now, you want to also determine the most appropriate policies and procedures to implement for employees, customers, vendors, and suppliers. Okay, what do I need to change? There are so many recommendations out there. CDC's got recommendations. OSHA has recommendations. What do I as an organization need to change? What policies do I need to implement? What policies do I need to change in order to make sure that we're protecting our employees? How do we address vendors? How do we address suppliers? Okay, how about visitors that come in? How do we take care of all of that in order to keep everyone safe? These are things that, as an employer, we are tasked to do and to make sure that we have answers for. And we also want to make sure that we clearly define any new roles, responsibilities, and expectations along with how employees will be held accountable. For a lot of what we're doing, we've had to cut back on the number of employees. Instead of having 200-300 employees or 150 employees at our facility, we're working with 100. We're working with 50, which means several employees have to wear different hats, have different responsibilities. Okay, what are those responsibilities? What are our expectations now as we are going through this pandemic? And how are we documenting all of this? Now, this goes back to when we start talking about the COOP. How are we documenting all of this to make sure that it becomes part of a plan, to make sure that this is something that we can have together. So when we are out of this pandemic and something hopefully doesn't happen, but if something ever happens like this again, we're able to pull it out and say, this is what we've done in the past. This is what worked. This is what we can do. And we start now. So having the plan to be able to do that. Now, those are the roles of employers. But if we step back and look at what is required by OSHA, the General Duty Clause, Section 5A1 of the OSHA Act, basically says that employers must furnish to each worker not just employment, but a place of employment that's free from recognized hazards that are causing or are likely to cause death or serious physical harm. Basically, what that's saying is if there is something that could hurt an employee the employer needs to make sure that they address that. Okay, this is the general duty clause that OSHA has out there, kind of a catch-all. But it applies, normally it's applied to slips, trips, those type of hazards, to falls, and we can address those as employers. Now, when we have something such as COVID-19, that changes a bit. Now we have to address that as well, because it also affects it could cause physical harm to our employees. So we're bounded by that. So we know as employers, we have several things that we're required to do, okay, that we have responsibility to do. As an employee during COVID-19, there are several things that the employee should be doing to slow the spread or prevent the spread of COVID-19 within the workplace. Some of these are understanding what COVID-19 is and how it spreads, making sure that they'll wash their hands properly, avoiding close contact with others, covering their mouth and nose when around others, covering coughs or sneezes, cleaning and disinfecting, staying at home if they're sick, following employer guidelines. Now, the same clause, the general duty clause that the employers should follow, which is Section A, okay, the employees have Section B they must follow, which states that employees shall comply with occupational safety and health standards and all rules, regulations, and orders issued to this act. Basically, if the employer puts out certain standards, certain rules, regulations, policies, the employee must follow it. Okay, that's what that part of the general duty clause states, and is basically saying. All right, so now we kind of understand where an employer stands, where the employee stands during this pandemic. Talk a little bit about the pandemic itself. Talk a little bit about what coronavirus is. If we have a better understanding of what coronavirus is, we are able to address those hazards much easier because of that understanding. Now, the coronavirus, if you see on this picture, the virus itself is basically made up of 3 parts. You have the lipids, which is the fats. That is that grayish part you see that encases that green part. You have that green part in the middle, that's the genetic material. For viruses, it's RNA. So that is the genetic material. Now on that picture, you see those red spikes coming out with little dots around them. Those are the proteins. Okay, those are the proteins that help bind to other cells. We'll talk a little bit more about that here in a few minutes. But understanding that a virus is made up of those 3 parts, lipids, the genetic material, and proteins, is important because we'll talk a little bit about hand washing and the importance of hand washing and how soap and the makeup of soap helps get rid of the coronavirus. All right, so what is the coronavirus? So the coronavirus, or is the novel coronavirus, is a new coronavirus that has not been previously identified. So the 2019 novel coronavirus, or 2019 nCoV for novel and then coronavirus, is a new virus never seen before in humans. Now, coronavirus itself is not new, okay? Coronavirus is a virus that causes things such as the flu. A coronavirus is what caused the SARS outbreak back in 2002, the severe acute respiratory syndrome back in 2002. Now, this coronavirus is called the SARS coronavirus 2 because genetically it's very similar to the initial coronavirus. So if we look at this picture here, okay, I had mentioned earlier that the coronavirus is made up of 3 parts. If you see that grayish part, those are the lipids, right? Those are the lipids, the fat that encases everything. If you see the red sticking out, the orange, the yellow, those are the proteins. In fact, if you see there on that picture, there's an S protein, which is the red little part sticking out. Well, the S protein, studies have shown that that is the actual protein that binds to the human cell. So many vaccines that are being worked on right now are addressing how to get rid of or somehow inactivate that S protein so it does not bind to the human cell. And if it does not bind to the human cell, then we're not going to contract it. We're not going to get sick. Okay, so that is a kind of the makeup of the coronavirus itself. Now, inside we have the RNA, which is the genetic material. All right, so coronavirus gets its name from its shape. So if you look at it, it kind of resembles a crown. Now, the word corona in Latin is crown, and that's where that name came from. It's because of its shape, and that is the nomenclature that was used to name that. So we've talked about coronavirus. Now, the question would be, well, what is COVID-19? Okay, well, they are not exactly the same thing. We've heard about COVID-19 and COVID-19 and coronavirus, but what I want to do here is make a distinction between these. Okay, the coronavirus is the virus that causes COVID-19. Now, COVID-19 is a respiratory disease caused by the SARS coronavirus 2. Okay, that is the disease. That is the illness that you get. Okay, SARS coronavirus 2, severe acute respiratory syndrome disease, is the actual virus that gets you sick. So there's a distinction there. There's the virus and the illness. Okay, you contract the virus, which in turn causes that illness. So it's we want to understand that that's the difference between those two. Now, COVID-19 symptoms. So these are some of the symptoms that may appear within 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19, which is the illness. Dry cough, shortness of breath, difficulty breathing, fever, chills, fatigue, muscle or body ache, headaches, sore throat. Now, these are symptoms that as employers, we want to make sure that our employees know what those symptoms are so they can be self-monitoring as well. Okay, so they can understand what they should be looking for. Now, doctors are learning new information about COVID-19 every day, including symptoms and lingering illnesses after someone has been exposed and has recovered from the exposure to coronavirus and COVID-19. Now, if you look at this presentation, if you see those two symptoms in blue, congestion and runny nose, nausea and vomiting, CDC just added those two symptoms last week. So everything changes. And things, especially for coronavirus, things have been changing almost on a weekly basis, if not on a daily basis, based on what physicians and scientists have been learning every day. And so that is why it's important to stay up to date. It's important to always look at the CDC website, the OSHA website, your local health department website to see what recommendations are there and what we should be doing. Okay. Now, again, this list is not all possible symptoms. And one of the things that we need to be aware of is several employees or several people could have the illness and be asymptomatic, which means they have no symptoms at all, but they're still carrying the virus and they're still exposing people to the virus. All right, so how does COVID-19 spread? All right, now that we know what the coronavirus and COVID-19 are, let's learn a little bit about how it spreads. We all know that being around a sneeze or a cough can expose us. But simply shaking hands or talking to someone in a social or professional setting can also put us at risk. All right, so especially when we are at our facility, when we're working, okay, we know let's stay away from someone that's sneezing. We don't want to be around there. But how about if we're just in a meeting How about if we're talking, we're at a toolbox meeting, going over certain blueprints, going over certain jobs, okay, certain requirements, certain orders. Okay, we might be pretty close there. Okay, so there are things that we need to know, things that we need to be aware of. Okay, so the virus is thought to spread mainly from person to person. This is what is called direct transmission. This is between people who are in close contact with each other within 6 feet. Okay, through respiratory droplets produced when an infected person coughs, sneezes, or talks. Now, these droplets can land in the mouth or the nose of people who are nearby, and that's considered an exposure right there. Yeah, and COVID-19 may be spread by people who are not showing any symptoms, as we talked about. Okay, now individuals that have coronavirus or COVID-19, even just by speaking, by using certain syllables such as TH for health, the studies have shown that has spread more droplets when people are speaking, when you use those certain syllables. So we need to be aware of that. Now, it may be possible that a person can get COVID-19 by touching any surface or object that have SARS on it or SARS-CoV-2 on it, and then touching their own mouth, nose, or possibly their eyes. This is considered indirect transmission. Now, this is not thought to be the primary way that the virus spreads. Okay? It is believed that it is through direct contact. Now, some examples here are work surfaces, tables, equipment, floors, door handles, keyboards, phones, time clocks. Okay, these are areas that may be contaminated, surfaces that may be contaminated. Then we also have to think about break rooms. We have tables, microwaves, refrigerators, sinks, doors, vending machines, coffee pots. Those are things that are surfaces where the coronavirus can land and stay. Okay. Now, when we are looking at classifying the exposure or the amount of worker exposure, OSHA has come up with an exposure pyramid that helps us identify where an individual, what level of exposure an individual may have, from very high risk to medium risk to low risk or caution. Okay, so how do we keep workers safe? There are lots of equipment that we can use. There's PPE, different chemicals that can be used, but understanding first what exposure the employees are at, that helps you make that decision. This is based on how close they are to other people, if they work with individuals that are sick, individuals that are suspected to have it, or for lower risk individuals, people that work at home, people that are isolated, people that are working behind a glass window. Okay, those are very low risk, but those risks vary, and it depends on what the action is of the employee. So how do we control workplace exposure to COVID-19? So during a COVID-19 outbreak, when it may not be possible to eliminate the hazard, the most effective protection measures are listed right here. So when we look at what OSHA states, there's a hierarchy that you follow. The first step is if we can get rid of the hazard, we get rid of the hazard. Unfortunately, we can't get rid of COVID-19. We can't get rid of coronavirus. There is no virus. There is no vaccine right now. So we go to the next step, which is what are the measures? And these are from most effective to least effective. Engineering controls, administrative controls, safe work practices, and PPE. As you see, PPE is the last line of defense. And the reason for that is people are involved. Okay, there has to be training involved. People have to use it correctly. People have to take care of PPE. People have to remember to use it, have to remember what the limitations are. So that's why PPE is at the bottom. Engineering controls could be barriers. You go to a grocery store, the register person is behind a barrier, okay, a plexiglass to protect them. That's an example of administrative controls. Safe work practices, they're type of administrative controls. They include procedures for safe and proper use to reduce the duration, frequency, or intensity of exposure to a hazard. Okay, some of these slides we're going to go over are examples of safe work practices. And so providing resources and a work environment that promotes personal hygiene, tissues so people can use if you got to sneeze or cough, no touch trash cans, making sure people wash their hands. So something to think about right now is if we have people washing their hands and require people to wash their hands, is there a requirement for antibacterial soap? Think about that. The answer is no. We're dealing with a virus, so antibacterial soap works with certain bacteria, not viruses. However, washing your hands, okay, the mechanical motion and how the lipids within the soap binds with the lipids and the virus and tears it apart, and then the mechanical motion of washing your hands, scrubbing your hands, tears the virus apart, and then you rinse it off. That is how washing your hands works. That is how soap works. There is no need for antibacterial soap. There is need for soap and water and proper hand washing. Okay, other resources, providing tissues, no touch trash cans. Okay, we talked about hand soap. Does not have to be antibacterial soap. Alcohol-based hand rubs containing at least 60% alcohol. So this is for your hands. If you're using a hand rub with alcohol, it must be at least 60%. If you're using alcohol for surfaces, it must be at least 70%. That is the CDC recommendation. Okay, 70% for surfaces, 60% for hands, at least. Okay. We talked about washing your hands, posting hand washing signs in the restrooms. We talked about how hand washing helps. COVID-19 is encased in that lipid envelope. It's a layer of fat. So what the soap does, it pulls apart the lipid, that gray area on that picture, on that virus, it tears that apart. And then the mechanical motion allows it to just fall apart. It's very, very simple to wash your hands and destroy this virus. The big question is, are we doing it? Can we do it? Some other infection prevention measures, having an infectious disease preparedness and response plan, which takes into account the COOP and takes into account what we do when there is a pathogen that we're dealing with. And the disinfecting protocols as well. You know, what needs to be cleaned? You know, how should it be cleaned? With what? Okay, how often should it be cleaned? These are things that we want to think about. Establishing disinfecting protocols as well. Very important to establish these protocols. Again, we mentioned for cleaning surfaces using at least 70% alcohol-based disinfectant. The easiest thing you can do is put together what is called a hypochlorite solution. The mix is 1/3 bleach with 1 gallon of water. Okay, one thing you do with this is make sure that it's done at least daily, because the UV light degrades the hypochlorite solution, so you need to do this daily. Another thing I want to cover real quick is how long does coronavirus live on surfaces? Okay, airborne droplets can contain viruses about 3 hours. Stainless steel up to 2 to 3 days. Plastic up to 2 to 3 days. Cardboard up to 24 hours. Glass up to 4 days. Copper up to 4 hours. Aluminum up to 8 hours. All right, so you know, information regarding the temperature and humidity is not known yet. Research is being done. More studies are being done to see if high temperatures will affect this. We just don't know yet until more studies come up and those are reviewed. But these are the things that we do know. So it's very important to make sure that we do disinfect our surfaces. Another thing we don't know is how much virus does it take to get someone sick? We don't know that either. So disinfecting is very important. Quickly want to go over continuity of operations plan. What a continuity of operations plan is basically a plan that you have in place so it can take care of issues. If something interrupts business, whether it's a natural disaster, an accident, a fire, or a pandemic, What steps do you take to stay in business? What can you do? Do you have to move? Do you have to reorganize? Do you have to restructure? Are you single sourcing your raw material? Where do we go? These are the things that a continuity of operation plan addresses. Okay. And in today's environment, we must also include specific risk dealing with COVID-19 in here. Defines risks that can affect the company's operation, testing the plan to ensure that there are no weaknesses. This is just a sample of what a COOP is. Right? All COOP plans have certain elements in common. This is just some of the things that are within a COOP. And within your COOP, you want to make sure that infectious diseases preparedness and response plan is in there. Addresses the risk factors, addresses what steps need to be taken to protect your employees. The new normal. What is the new normal? What will the new normal be? We don't know yet. We do know that it's not going to go back to the way it was. We're going to have to adapt. Organizations, we're going to have to change how we do things. Okay. Right now, we work with organizations where we're trying to make sure that they're efficient. We're trying to make sure that products, processes flow, services flow. We still want that, but now we have to incorporate employee safety in regards to COVID-19. PPE, distance. Okay, those are the things that we're looking at. Any questions regarding this? I know went through this kind of quickly. Try to give you as much information as I could within the allotted time, but there's just a lot of information. There's my contact information if you'd like to ask any questions. And also, this is an example of the actual full 4-hour course for management and 2-hour course for employees that's offered. Okay, Wendy.
Thank you so much. And so if we're interested in attending one of these trainings, do we just go to the website or do we contact you directly?
You can go to the Texas A&M Engineering website and you can go ahead. These are all online. You can go ahead and register there. They are offered several days a week through the LMS. We will be recording a course and placing it on the LMS. Not sure when that's going to happen, but right now they're all instructor-led. So I teach all of these currently. Great.
Now, is there a fee associated with these classes?
There is a fee for the managers, the managing business during COVID-19. The 4-hour course, it's $200 per person. Okay. The workplace safety, it's $100 per person. That's the 2-hour one.
Okay. Well, Shay, do we have any questions from anyone participating in our webinar today?
None have come through yet.
So, yeah, this is a lot of information, and I'm still myself kind of processing it. This is very, very helpful, especially understanding the virus itself and how important it is to use soap and water to wash your hands. It's kind of the basics. But
it is, yeah. And that's one of the things, understanding how we can protect ourselves is really understanding what this virus is and how it functions, so we can take steps to protect ourselves from that. So that's kind of the goal of this presentation is to instruct, to make sure that we have a better understanding, a better foundation, and then from there we can build on our plans, taking into account the information.
Yes. Well, we appreciate your time today, and for those of you on our call, we do appreciate your time as well, and we look forward to hearing from you again, hopefully in the future at some point, as we all learn to live with a pandemic, an active pandemic in our workplaces and our personal lives as well. So thank you so much for your time and your information today. And so, yes, we've got our phone number on the screen now. If you've got questions or want assistance in getting contacted and connected with the Engineering Extension Office at Texas A&M, please don't hesitate to call us or reach out to anyone on our staff as well here at the Chamber. So, Esteban, thank you for your time and for the information. It was very, very helpful.
Thank you. Thank you for inviting me. I appreciate it.
Sure. Bye. All right. Well, everyone have a wonderful day and enjoy, hopefully, some sunshine that peeks through our dust cloud. Take care.